Hello everyone, welcome to my new video in which I'm gonna describe a horrifying syndrome which completely changed the appearance of the sufferer, hypertrichosis. The nation was shocked when a teenage boy from India with a rare medical condition known as werewolf syndrome came forward and spoke about his experiences with peer bullying. The prevalence of this condition is pretty rare as there are only about 50 cases of this kind of hypertrichosis ever been documented. It's the 21st century, and now it's high time for us to educate ourselves on things that are rare or uncommon rather than using it as an excuse to spread havoc. Here is a full guide on the werewolf syndrome, officially known as hypertrichosis. This syndrome is a rare condition characterized by excessive hair growth that may develop all over the body or be isolated to specific areas. Hypertrichosis may be congenital or acquired. Acquired hypertrichosis can further be classified as generalized or localized to small patches. These disorders can have either vellus, lanugo, or terminal type of hair. There has not been any specific etiology, but it could be linked to porphyria cutanea tarda, androgenic steroids, lichen simplex, or malnutrition. Also, medications such as minoxidil, phenytoin, and cyclosporin have been linked to abnormal hair growth. Scientists have discovered a genetic mutation responsible for a disorder that causes people to sprout thick hair on their faces and bodies. Researchers knew the disorder runs in families, and in 1995 they traced the approximate location of the mutation to a section of the X chromosome, one of the two sex chromosomes, in a Mexican family affected by hypertrichosis. Men with this syndrome have hair covering their faces and eyelids, while women grow thick patches on their bodies. In March, a Thai girl with the condition got into the Guinness Book of World Records as the world's hairiest child. A man in China with congenital hypertrichosis helped researchers break the case. Zhu Zhang, a professor of medical genetics at the Peking Union Medical College, tested the man and his family and found an extra chunk of genes on the X chromosome. The researchers then returned to the Mexican family and also found an extra gene chunk, which was different from that of the Chinese man and the same location of their X chromosomes. The extra DNA may switch on a hair growth gene nearby, resulting in runaway furriness. The best bet for a culprit, wrote study researcher Pragna Patel of the University of Southern California, is a gene called SOX3, which is known to play a role in hair growth. If in fact inserted sequences turn on a gene that can trigger hair growth, it may hold promise for treating baldness or hirsutism, excessive hair growth, in the future, especially if we could engineer ways to achieve this with drugs or other means, Patel said in a statement. Since there have been very few cases around the globe, there is limited research data for the treatment of this disorder, and it becomes necessary to guide such patients and boost their morals so that they could spend their lives like normal human beings.
13-year-old Lalit was born with a rare congenital condition known as hypertrichosis. The disorder causes excessive hair growth.
There are various types of hypertrichosis. The first one is congenital hypertrichosis lanuginosa. It can be seen first as normal lanugo, the fine hair seen on a baby at birth. Ideally, this hair should disappear during the subsequent weeks, but instead the soft fine hair continues to grow in various places on a baby's body. The second case is congenital hypertrichosis terminalis. In this condition, the abnormal hair growth starts at birth and goes on throughout the person's life. The hair which grows on the person's body is usually long and thick. The hair can cover the person's face as well. The third condition would be nevoid hypertrichosis. Here, the unusual and excessive hair growth appears in a defined area. In a few cases, more than one patch of hair can be seen too. The fourth case is hirsutism. This form of hypertrichosis can only be caused in women, and it results in dark, thick hair growing in place women normally don't have hair, for example, their face, chest, and back. The fifth condition is acquired hypertrichosis, which is different from congenital hypertrichosis, which starts at the person's birth. In the acquired form, the disease tends to develop later in life. It affects the person in ways of hair other than lanugo, vellus, or terminal hair.
Hair is characterized as lanugo, which is unpigmented, fine, and soft, and is typically about 3 to 5 centimeters in length. There are more aggressive forms of the disease leading to more widespread hair, and then there are less prominent forms which will yield finer hair further distances away from one another. Other traits seen with this disease appear to be larger gums and poor teeth prominence in those gums. This does not have too much of a profound effect on the person concerning difficulties eating, but it suggests that there is more going on here than just hair growth when it comes to the body and traits displayed.
In this condition, excessive hair growth can bring out small patches or all hair growing areas of a person's body. Symptoms of hypertrichosis or the werewolf syndrome. As mentioned formerly, hypertrichosis can arise at the time of birth or can develop later in life. Hypertrichosis usually generates one of three types of hair: vellus, lanugo, terminal. Problems with gums or teeth can also be seen as a symptom of hypertrichosis. It is when some of your teeth may be missing or your gums may be enlarged. Causes of werewolf syndrome. The causes of hypertrichosis aren't well comprehended at the moment, though it's observed that this condition tends to run in families. The condition of congenital hypertrichosis may be a result of the reactivation of genes that induce hair growth. According to the research, the genes that used to cause extensive hair growth in early man have shut down with time during the course of evolution. There's a hypothesis that somehow the hair growth genes turn on while a baby is still in the womb. Acquired hypertrichosis causes. Porphyria cutanea tarda. It is a condition where your skin is extremely sensitive to light. Malnutrition. Diets, eating disorder like anorexia nervosa, cancer, drugs like the hair growth drug minoxidil and cyclosporine. Lichen simplex. It's a chronic skin condition that can cause itchiness and scratching of a patch of skin. Temporary use of a plaster cast. Increased vascularity, which is a bodybuilding technique to develop prominent blood vessels near the surface of the skin. Treatment of hypertrichosis or the werewolf syndrome. The werewolf syndrome or hypertrichosis has no cure, and nothing can be done to prevent disease since it's by birth. Treating hypertrichosis does involve a variety of short-term methods like shaving, chemical ablation, waxing, plucking, hair bleaching. The methods mentioned above are interim treatments and can run the risk of causing painful or uncomfortable skin irritation. They can't be done on each and every part. Some long-term treatments include electrolysis and laser surgery. The hair loss with these treatments can be permanent and might have to invest in a few sessions to complete the job. After knowing all of this, the one thing we can do to help these people is to be kind to them. The person going through this is already facing so much, so let's educate ourselves and provide each individual with a healthy social environment.